Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How to fix an ingrown toenail with or without surgery. Ingrown toenails are a common foot complaint. They occur when the edge of a toenail starts growing into the surrounding skin, causing pain, swelling, and discoloration, potentially leading to an infection. /r/n/r/n Some mild ingrown toenails may be managed with at-home remedies, but severe or infected cases require treatment from a healthcare provider with prescription medication or surgical procedures. /r/n/r/nito 100, Getty Imagesrnrn Treating an ingrown toenail at home will depend on the severity of the case and whether there's an infection. /r/n/r/n At home management may be appropriate for most mild and some moderate ingrown toenail cases. This includes ingrown toenails that present with symptoms like /r/n/r/n if you have diabetes, poor circulation, or nerve damage in the foot. Do not treat the ingrown toenail at home. See a healthcare provider. /r/n/r/n The goals of treating your ingrown toenail at home are to relieve symptoms, prevent it from getting worse, promote healing, and reduce the chances of it happening again. /r/n/r/n For mild, and some moderate, ingrown toenail cases, here are some evidence-based tactics to start with. /r/n/r/n If home treatment of an ingrown toenail appears to be working or improving, it may still take several days or more to resolve fully. Experts note that successful at-home treatment should continue until the nail grows past the curved edge, which can take 2 to 12 weeks. /r/n/r/n Your ingrown nail may require medical treatment if it's a moderate or severe case that isn't getting better with home treatment or even seems to be getting worse. /r/n/r/n A moderate to severe case is generally classified as presenting with the typical ingrown toenail symptoms like pain, swelling, and discoloration, but to a much more severe degree. In addition, the skin around the edge of the affected nail may thicken, start to grow abnormally, or appear red or discolored. /r/n/r/n Healthcare providers recommend medical treatment for ingrown nails if /r/n/r/n People with a health condition that can increase the risk of developing foot issues, like diabetes, poor circulation, or nerve damage to the foot, should not attempt at-home treatment for an ingrown toenail. Instead, see a healthcare provider for diagnosis and medical treatment. /r/n/r/n An infected ingrown toenail will likely require prescription antibiotics like Keflex, cephalexinto to clear the infection. The entire course of antibiotics must be taken to help prevent recurrence, even if symptoms improve. /r/n/r/n A healthcare provider may recommend surgical treatment for severe or frequently recurring infected ingrown toenails. /r/n/r/n Ingrown toenails can be quite uncomfortable. Generally, over-the-counter, OTC, pain relievers like Tylenol, acetaminophen, or Advil, ibuprofen, can help temporarily reduce pain. Advil can also help relieve inflammation. /r/n/r/n Otherwise, a healthcare provider may offer the following. /r/n/r/n Physical activities like walking can be difficult with an ingrown toenail. Until it's healed, consider /r/n/r/n Sometimes, surgical intervention for a severe ingrown toenail is needed. Research suggests that surgical procedures help prevent future recurrences better than non-surgical treatment options. /r/n/r/n Two common procedures for ingrown toenails aim to remove contact between the affected nail and the corresponding skin fold. /r/n/r/n People who have an allergy to local anesthetics, peripheral vascular disease, a blood circulation disorder, or a bleeding disorder may not be candidates for these surgical procedures. /r/n/r/n Post-surgery, many people find they can go back to normal activities after a few days. /r/n/r/n nail grooming can help prevent ingrown toenails and other nail issues. Here's what experts recommend. /r/n/r/n note that toenails grow more slowly than fingernails, so you may not need to trim them as often as you manicure nails on your hands. /r/n/r/n ingrown toenails that keep coming back may require additional medical treatment. /r/n/r/n in these cases, a procedure known as a matrixectomy may be performed at the same time as a nail avulsion. This removes or destroys the nail root, preventing the toenail from growing back. The different techniques that are generally used include /r/n/r/n people who have certain health conditions like uncontrolled diabetes or peripheral vascular disease, and people who are pregnant may not be eligible for a chemical matrixectomy due to chemical exposure. Check with a healthcare provider to discuss the best surgical options for you. /r/n/r/n ingrown toenails happen when the edge of the nail starts growing into the skin. In mild cases, at-home treatments like soaking the foot, applying a corticosteroid, and temporarily wearing open-toed shoes may relieve pain and resolve the issue. /r/n/r/n people with diabetes, nerve damage to the foot, or poor circulation should see a healthcare provider rather than treating even a mild ingrown toenail at home. /r/n/r/n for severe ingrown toenails, medical treatment is generally required, which involves antibiotics to clear an infection and surgical procedures to remove part or all of the affected nail if needed. See a healthcare provider for a suspected ingrown toenail that does not improve or worsens after a few days of home treatment. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.